Uh-huh.
Oh, there it is. Okay. I'll edit that part out. Welcome to the Diversity and Inclusion on Air podcast. The podcast is a program of the Association of American Veterinary Medical Colleges Diversity Matters Initiative. This podcast explores various issues related to diversity and inclusion in the veterinary profession and provides the AAVMC an opportunity to offer ongoing diversity programming to our member institutions as well as all veterinary professionals. My name is Lisa Greenhill, and I'm the Senior Director for Institutional Research and Diversity at the AAVMC. So on today's episode of Diversity and Inclusion on Air, I am delighted to welcome Dr. Luana Nan from Purdue University's College of Veterinary Medicine. Hi.
Hi. Thank you so much for inviting me.
Thank you. Thank you. Thank you for joining us. So today, Luana and I are going to be talking about wellness issues and diversity specifically, and kind of what are some of the maybe specific or unique issues related to wellness through a diversity lens. So as is our custom, I'd like to invite Dr. Luana Nan to introduce herself and tell us a little bit about yourself.
So I'm a psychologist serving the students, interns, and residents here at Purdue College of Veterinary Medicine. I started working here about 5.5 years ago. Before then, I worked at different counseling centers. I always loved, actually, since I graduated from I graduated from the College of Counseling Psychology at University of Illinois Champaign-Urbana with a PhD in counseling psychology. And since then, I worked at different counseling centers. I love working with students, and I'm really excited to have now an opportunity to work very closely with a particular group of students. This really gives me a great opportunity to have a closer, deeper understanding of their experience, of their culture, academic culture, professional culture, and also to have a different kind of impact that takes context more into consideration.
Sure. So are you based specifically within the College of Veterinary Medicine at Purdue?
Yes, I'm an embedded counselor and I work here full time.
Okay, awesome. And are you the only counselor that they have there, or do you have colleagues that work with you?
No, I don't. I am the only one hired for now, and but we're looking into hiring a veterinary social worker soon, and I'm really, really excited about that.
Great. All right. Wonderful. So let's dive in. So the veterinary community has been doing a really great job the last couple of years of kind of exploring issues related to wellness, specifically with respect to students, but also faculty as well as clients, and kind of some of the things that folks are exposed to in the clinical setting. And certainly we've been working on diversity for a really long time. And so I think that the profession has certainly done a lot to bring attention to both of these issues separately, but is there a place for us to really kind of talk about these things together?
Oh, yes, absolutely. Absolutely. I think that they're intrinsically connected and actually overlap a great deal. I don't think we can talk about wellness without talking about connection with others, a healthy social environment, without enrichment in one's own understanding of the diversity of the world and diversities of ideas and ways of being. And I think it's a crucial part of wellness and well-being.
Sure. So what are some of the things our colleagues should know about mental health and wellness issues, particularly for marginalized or underrepresented populations within the vet school community?
Mm-hmm. Well, I'm happy to share my perspective from my own experience. I would say that a very common theme, common issue that I hear is about belonging. I think this tends to be an important challenge for students who are coming from marginalized, underrepresented communities. And what I mean by that is really feeling like they're integrated in the school, in their class, and that can be a bumpy road at times. And it's interesting. I read recently a book by Brene Brown, Braving the Wilderness. It's a really great book. And I want to say that she talks about the difference between fitting in and belonging. And I love how she expresses this difference. She says, you fit in when others accept you for being the way they are. And belonging is about being accepted for who you are.
Oh, wow.
And I think that, this is a really complex kind of journey, and I think too often the goal is to fit in, or maybe the expectation is that this is maybe the best that could be reached, to fit in. When, it's belonging that really supports one's wellness and one's well-being.
Sure.
So I think this is a really important theme for students coming, from these communities, from marginalized communities. We are all aware that a common experience, especially first year, although I would say throughout vet school, because every year brings its own unique challenges, students are struggling with imposter syndrome. And I think that for students for underrepresented, marginalized students, are this imposter syndrome, it's experienced with a different degree of intensity, because it's really about intersection of multiple factors here. If you're stepping into a culture where that you might experience is very different from yourself, or having very few individuals that look like you or represent the values and that you embrace, I think that's likely to make that imposter syndrome more intense, more challenging. I think it's very much easier to go to that place where you wonder, do I really belong here?
Yeah.
And I think this is also at times exacerbated by the fact that quite a few of these students don't have the support network of other students. And that includes, support, like local support network, like school, college, also sometimes at home, because, some of them come from families where, people are not aware of, the challenges of vet school or, professional school in general. And that makes it even hard to navigate their multiple roles.
Sure. Imagine it is challenging. We just did a climate survey last year, and we did find that there's, a fair amount of veterinary students who report not feeling like they have that kind of supportive group of student colleagues that they can go to and just kind of talk and have shared experience with. But I think that the other piece that you mentioned about the imposter syndrome is kind of not only, do students who may not see many other people like themselves there kind of wonder, should I be here? But they also may feel the burden of, and what happens if I'm not successul? They may never give another one of us a chance, right? And so there's kind of this, do I belong here, or do I really, have I really arrived here? But also, what does it mean if I am not successful, however we're defining success?
Right. And I'm glad that you're mentioning this, how we define success, because I think, like everything else, is it's a cultural definition, like it's culturally defined, right? What success looks like, what to be a professional is about. That's culturally defined, right? And I'm not sure that we always realize this.
Yeah. So what are some of the maybe cultural challenges, i.e., do certain groups, and I recognize that we might spill over into potentially stereotypical kind of landscape broad statements, but what about taboos around seeking mental health or counseling services, or just being able to ask for help? What are some of those challenges that maybe you've come across in your practices?
Well, I think it's at least twofold. One, yes, I do recognize that there is often a stigma associated with counseling, mental health related services, and I hope that having now. Many schools have an embedded counselor, I think, who is more visible, who has a chance to show the humanness, the person behind the role. I think this could, and also the opportunity to have multiple conversations to demystify this notion of counseling. I think this can be helpful, but it is that stigma is still there associated with this, and what it means to go, see a counselor. And I think another part of this, important part of that, well, I should say something else about stigma. Unfortunately, there's also a professional culture related stigma. It just so happens that the veterinary profession, I think, tends to associate the stigma too. Not only stigma to mental health services, but, there's still quite prevalent this view that, again, the professional, the veterinarian is always someone who only experiences a certain set of emotions, never seeks help, is the one always giving help and having everything together, not having any challenges, because that's oftentimes perceived as weakness. To be vulnerable is perceived as weakness. Yeah. And I think this only kind of deepens the preconceived notion that some of the students may come in to begin with. Yeah. As another aspect is related to trust. I think there's still more work to be done in that regard, to have students from especially underrepresented students trust the system and trust the college and trust the counseling services. I mean, we're all aware of the history, and unfortunately, I mean, recent history and current, events and everything else, I think that really challenges trust. So I think, and speaking of this, another theme that I hear often is related to this impression that the diversity efforts are focused very much on numbers and not so much on actually on inclusion and integration.
Yeah.
And that, of course, is related to trust as well, right?
Absolutely. Absolutely. Yeah. I mean, you've hit on such an important point in why AAVMC does have, some efforts related to helping our colleges understand the importance of climate, right? As well as kind of the hidden curriculum and how students are learning to engage one another. But also, if you say that these things and diversity and inclusion are your core values at an institution, what does that look like, right? And so, that doesn't just mean kind of representative or structural diversity, but also looking at, kind of what kinds of programs do you have? What kinds of speakers do you invite to campus? What kinds of content do you promote? And really kind of helping people feel, again, like you said at the top of the show, that they belong here, that they're a part of the college's community and the college's family, and how do you reinforce that and help to build a culture of mutual trust? I think that it's particularly challenging currently, because there are so many things in the news as we're recording this show. We just, there was just news earlier this week of a student at Yale who fell asleep and, woke up to be confronted by police because someone wasn't sure that they, air quote, belonged in their dorm, and kind of what are the lasting impacts of that when you're potentially the lonely only and an event has occurred and that questions your belonging. Yeah. So what are some of the structural changes? You mentioned that at your institution, Purdue University, you're hoping to bring on a social worker. I'm assuming that that's because there's more work than you alone can handle. So what are some of, I guess, the institutional challenges to helping to create a culture of belonging and inclusion and trust, where every student, regardless of background, feels that they can actually seek out assistance?
Well, I think that a part of this is about access. I think it's great that more and more schools have their own counselor, on-site counselor. I would say, though, that there's still more work to be done in terms of access. The program demands and the schedule continues to be very, very, very heavy for students, and allowing for very little time to take care of oneself or to address issues, and to stop and reflect and acknowledge, or even stop to take care of some other things that are going in the student's personal life. So I think there's something about the program too that will need to probably change in time to honor these other aspects of students' life. And I think another very important factor, maybe even more important, is about the community, the professionals, faculty and staff. I think there's more work that needs to be done in terms of education, training, to deepen cultural understanding, and also build more sophisticated skills in how to address challenging conversations or challenging issues. I think there's still more to learn in that regard.
Yeah, sure. I mean, I do think that there's, I think that we're starting to see how cross-cultural communication can really potentially break down in the veterinary setting. I think that there's certainly been a lot of work done in human healthcare on this issue, and there's a lot of opportunities for us to learn from that. But we're starting to kind of see some of those things that, and even when we talk about issues around kind of malpractice, it's usually not really so much about the medicine. It's really about communication and kind of challenges around communication, whether it's a cultural nuanced issue or not. Communication and kind of understanding and the ability to develop kind of interpersonal empathy. I think that this is a profession that shows an enormous amount of empathy for their patients who have multiple legs, but that there's some room for greater knowledge and learning and awareness around the empathetic needs for the interpersonal.
Yeah, absolutely. I think that's crucial. Yeah.
Yeah. So, what might some of the diversity disparities, mental health disparities, kind of how do you see that potentially manifesting in the college environment?
One aspect I already mentioned, I would say the way in which the adjustment to vet school and the imposter syndrome that is kind of carried almost throughout a college career has multiple layers to it, and it's more complex. And I see, I can mention a limited support network that is definitely contributing to the difficulties. It's much harder to cope with psychological challenges, or to cope with grief, to cope with loss, to cope with whatever life brings, family problems and anything else, when you have a limited support network.
Sure.
And that sense sometimes that you're not, that where you are doesn't always feel like home. And just recently I was talking actually with a student exactly about this, that sense is never quite there, that this is home. And it's affecting everything else, right? I think we all need this really, again, going back to belonging. We need this sense of belonging to a community, to feel encouraged to be one of an integral part of this community. I would say that the challenges could be around financial situation as well, that bringing much more significant stress, and in multiple ways, going from, including concern about financial debt, concern about, day-to-day expenses, and how I'm going to have, my needs met. And that, is associated with sometimes having to look for more work, which, we're talking about already, very busy students, and having to work, have multiple jobs to provide an income. And oftentimes this is not only to sustain oneself. Oftentimes there's a care about the ones that are at home, family at home, and continuing to care for them and to want to provide for them in many ways. And so this is another important layer contributing to stress. And I would say even something like, again, going back to social, to support, financial difficulties can, for example, prevent a student from affording to go visit home. So meeting family or having family over, and again, it's also interconnected and affecting well-being in so many ways. And so I see these disparities, and of course they play out, and they in affecting academic performance as well.
Yeah, I think that's an important point. And we did a survey, a study in, I believe, 2012, 2013, specifically around LGBT student experience, and we asked two big questions. One really about what is the climate like here for LGBT students, and how do you think that is impacting your academic experience there? And some of the things that we found out was that the more I guess disconnected the student felt, or the more potentially the environment felt hostile, the more withdrawn the student was, right? And so they didn't necessarily socialize with their colleagues. They didn't go to study groups because they were kind of really afraid of what might happen socially in those study groups. They were less likely to be participatory in classes, which will negatively impact their grade. They may be less likely to participate in student organizations, which limits leadership opportunities, but also the ability to do networking, to find, potential employment afterwards. So it just has this, 360 kind of impact over every aspect of their life. And in addition to potentially being away from home and isolated familially as well as socially. And so these are all very real things, I think, that many students are grappling with. But for students who are coming from potentially marginalized or underrepresented backgrounds. There seems to be a kind of heightened sense of intensity potentially in these feelings. So what are some of the things that our colleges can do to bring some awareness to this, of these unique situations around specifically diversity and wellness? Maybe what are some of the things that you've done at Purdue, and what wisdom, Luana, can you give us? What can we do?
Great question, and I'm that's work in progress, finding different answers and solutions to this, because it's so complex. I'm happy to share something that a colleague of mine and I attempted to do. Dr. Colleen Cipriani, she was the director of a diversity action committee, and she and I collaborated, and because she was on the diversity aspect of things, I'm a wellness representative, so to speak, in a college, and we talked about, hey, because we both believed in these two really being married together, and we decided we need to make this explicit in our college, and this is the way to make it alive, to make diversity alive. And so we started having conversations with students. We called those meetings professional development, being mindful of needing to package in a way that, would be attractive to students. Because yes, there were some who said, who reacted along the lines of, well, I came here to learn medicine. Why do we need to talk about these things, And so we started having conversation with students, like really inviting them to take a step back and reflect on how they carry conversations that present, challenges, that gets them out of the comfort zone, that enlarges their perspective, that really honors diversity, and how welcome they all feel, how the degree to which they feel they belong. And and they were really, and still are, very interesting conversations, rich conversations. And it's not an easy journey, because it's, people are hesitant to be transparent, of course, and there are other students who mistrust the dialogues, and they're not sure whether they can be safely express their experience. So yes, we are stepping into this uncomfortable territory, but I think that we need to, we need to do it. And so yes, that's what we started to do, just asking students to think about how they live that, what it looks like to be a diverse class, and how they are holding that, and how is that really including everyone. And we also try to kind of help and support them. Maybe there are little teaching, guiding moments to help them express things in a way that honors their own experience, but also is considerate and empathic towards others, and I think this is can be very, very helpful for students, to have this kind of conversations.
Mm-hmm. Mm-hmm. Yeah, I think that sounds great to really kind of foster those kinds of conversations. I think that one of the biggest challenges for me in the history of at least my work and kind of promoting diversity and inclusion, when folks say, well, yeah, but I mean, I'm just here to practice medicine. I'm like, this will help you practice better medicine, I guarantee. If you can kind of figure out how to break down some of these walls, there's really great opportunities on the other side of the wall. Please, really try to push through and kind of learn to engage and to find other ways of being collegial. I really appreciate this kind of the kind of student to student dialogue that you all are promoting. Again, I mentioned that we've been doing some work around climate, and students are sadly the primary folks that that everyone is engaging, and they are also the folks that students are reporting that students are the ones that are kind of the least empathetic with one another, like that there is some shared misery. So that's, misery loves company. There's some of that. But in terms of problematic language around race, around gender, around sexuality, around gender identity, all of those kinds of things, students are reporting that they're hearing kind of that problematic or hostile language from their peers. And so the efforts to improve or even initiate some really kind of empathetic dialogue to kind of help, bridge those gaps and reduce that type of friction and conflict, I think will certainly benefit everyone.
Mm-hmm. Absolutely. I think, yes, students talk very often about microaggressions. They experience them very often. And I think what makes it very tricky is that, they're often very subtle.
Yeah.
And you have this package of, oh, I was just joking, or, oh, students taking things too lightly, and makes it so challenging to confront that, and to acknowledge it for what it is.
Yeah, I mean, we did a show some time ago on microaggressions, and one of the big challenges is oftentimes you feel icky in the moment, but you can't even unpack it right then because sometimes you don't know, that it's not okay, but you can't exactly put your finger on why until, 30 minutes later, and the moment for resolution or conflict and resolution has long since passed, right? And so then you're just kind of left with this feeling, this exclusionary feeling.
Yeah.
So as we get ready to wrap up, I'm kind of curious about.
I want to say one more thing.
Yes, absolutely.
Okay. Regarding of what we can do as colleges,
Yes.
There's an aspect that's really, I think, really important culturally too, because we're talking about belonging and community. I think that cultivating more mentorship, and I emphasize mentorship, not advising, mentorship, which is, conducive to a much deeper connection and richer relationship. I think this is really, really important, especially for underrepresented students, to help support that sense of belonging. And again, not just, a professor who meets and is asking, oh, how are you doing in school? Tell me your grades, and I mean, that's important too, part of that.
Right.
But no, I think mentorship is needed. Right. And I would love to see more training around that with faculty. And not just that, also, let's face it, it's a veterinary profession is filled with loads of work, right? And I think it's important systemically to think about how to create space for this kind of for mentorship, for this kind of relationships, and to think about ways in which we can reward this kind of engagement for faculty and staff, to make it just as important as publication or a clinical work. I think it has to start top bottom, to show this is important. Going back to the statement you mentioned that you heard somebody made, we're here to practice medicine. I think it needs to start from top bottom to send the message. No, medicine is about who you are as well and how you connect with the people around you.
Awesome. You preempted my last question on what faculty can do. Awesome. So So, but I would actually extend that to certainly beyond just the college environment, but that there is a real need and desire for greater mentorship across the profession, and those those new and recent graduates still need mentorship as they enter the profession, as they leave the collegiate environment, which we recognize that that's still it's a microcosm, but there's still a bit of a cloistered environment, at vet school as well. And so even in that transition out into the profession, there's still a real need for mentoring, good mentoring training. I'm glad that you mentioned that as well. And kind of what does mentorship, what should it look like? What are the elements that it should have? And I think that there's a real need for greater work around that, both for professionals as well as for mentees as well, so that they learn eventually that they'll turn into mentors too.
Right. One great initiative here at Purdue is a so-called diversity certificate that entails, different, so a teaching component, educational component, going through modules that when one can learn about different cultures and different populations, and they also they're required to participate in activities that will engage them actively, that would help them acquire, have a lived experience of a group of individuals who are different from themselves, and volunteer activity as well. And after which they are granted this certificate. I think it's a really great initiative, and I hope again that many faculty and staff will be encouraged to do it.
Absolutely, yeah. So I'm so glad that you brought that up. That the Purdue Veterinary Medicine has their kind of the certificate program. I think that a lot of people know about within the Center for Diversity and Inclusion, the Center of Excellence, which is that particular certificate program is available to everyone in the profession. But within the college, as a part of alongside the curriculum, students are able to take. You all have, I guess still called the Diversity Key program? Yeah, the Diversity Key program, which is the certificate program. And so Purdue students are able to even get that certificate, but they also have that designation as a part of their DVM degree, which is just really incredible and a unique program at Purdue. So folks, check that out. If you're an applicant, you might also, if you're interested in these issues, there's your Purdue plug, but there's certainly other programs at other colleges of veterinary medicine. So be sure to check them all out. So great. Any parting advice for not only students, but faculty, leaders, and veterinary professionals who may be listening in?
I would say that I would just encourage everyone to take time to think about, to reflect on their daily experience and about, their presence, about how they relate to others, trying to stay mindful of that. I think that's where it all starts. With asking oneself, how was today, and how did that conversation really go that I just had earlier, and I wonder how that came across, and also remembering maybe to check in with the other person that they had the conversation with or that they interacted with, maybe to revisit if they feel that, that exchange could have gone differently, or if they have some questions about whether whatever it is that they do or they say comes across. It starts with oneself. So I think that's, we talked about, which is all so important, systemic approaches and what we do as a group, but to not forget to do that, you know, starts with the person in the mirror, right?
Yeah, be reflective. I mean, I think that it's just, and in this day and age, just taking time to be reflective is really hard. You're looking at timelines wherever, Facebook, Instagram, Twitter, and all of those types of things. And, there's tickers at the bottom of your news screen. And so it's really, really hard. But I think that that's great advice to just take a few beats to reflect on how you engage with one another. And if there's an issue, it's okay to go back and revisit it.
Yeah.
That's great. Thank you. Thank you for joining me on the show. I really appreciate you taking some time out of your schedule.
Oh, I'm so happy to be in this conversation. Thank you so much for inviting me. It's a great opportunity. I really appreciate it. I'm grateful.
Thank you. So this is another episode of Diversity and Inclusion on Air. Actually, this is our final episode for season 3. We will be taking the summer months off. Don't worry, we've got some episodes in the can, so we will still be putting out great content as we take a little time off to plan season 4. Thank you so much again, Dr. Nan, for joining us. I really appreciate it. And to everyone else, again, be reflective, be kind. Be sure to check out back episodes on iTunes, Stitcher, or your favorite podcast app. And be sure to take a look at us on Facebook, where we are AAVMC's Diversity and Inclusion on Air podcast page. Thanks so much, and we will see you in the fall.